Today we're going to talk about osteoporosis. Osteoporosis means porous bone. It is a very common bone disease that affects more than 3 million people in the U.S. per year. It is the most common disease that affects bone, but it's not necessarily a consequence of the aging process because some elderly people retain strong, relatively dense bones. Osteoporosis causes bones to become weak and brittle. Our bodies constantly absorb and replace bone tissue, but with osteoporosis, the new bone creation can't keep up with the old bone removal. This puts patients with this disease at an increased risk of fractures due to the alterations in the bone microarchitecture. The bones lose density, become thinner, and more porous over time. This is a chronic disease that will often progress silently for decades until a fracture occurs. The clinical manifestations are based on what bones are affected. Most commonly, there is pain and deformity as a result of the fracture, which, as we talked about, happens in the advanced stage of this disease. Fractures are likely, and as bones lose density and become brittle and weak, they may also collapse. Vertebral collapse is seen commonly, which the medical term is called kyphosis. This is when the person looks like they're hunchbacked and causes their height to decrease. The gold standard for diagnosing osteoporosis is a DEXA scan. This is a non-invasive test that measures bone mineral density by using two X-ray beams with different energy levels that are aimed at the patient's bones. The primary goal in treatment is to prevent fractures. Patients are prescribed bisphosphonates as a first-line medication choice. This medication helps prevent fractures by reducing bone absorption. It's also important to encourage regular, moderate weight-bearing exercises because these are useful by helping slow the rate of bone loss and reduce demineralization. Since weight-bearing exercises stimulate bone formation, it is very important to teach your clients. Also, it's very important for your clients to have adequate calcium and vitamin D. This is essential for normal bone structure. And this concludes osteoporosis.